today under the program of Meet the Expert, that is COVID-19 pandemic special care for the mental health. And for this topic, we are very grateful to have the doctors who are truly eminent and masters of this field. And I first of all thanks and welcome our speakers, Dr. Abdul Majid and Dr. Amol Deshmukh, for today's session. Before going to it, I will just start with the short introduction of our first speaker, that is Dr. Amol, which he will be taking the topic COVID-19 pandemic psychological perspective.
So, welcome all viewers to this webinar by me and Dr. Majid sir. So, welcome all. Good afternoon. I am covering today's topic, that is COVID-19 pandemic and a psychological perspective. I know this is a very vast topic to talk about. There are lots of issues about psychological health and related to pandemic and COVID-19. But I will touch on most the important aspects only in today's next 20-30 minutes talk. I think this time we all together talking about 3 P's, that is pandemic, politics and psychology. And yes, we all should it's time to understand about the emotional literacy of all of us during this pandemic. This pandemic given us opportunity that mental health is much more important, and this is time to understand this aspect of mental health which is often neglected. Initially, in the few days of the lockdown, we were talking about the physical consequences of the COVID-19 pandemic, and still we are talking. But now, significant psychological consequences are emerging out, and that needs to be addressed. Dear friends, this pandemic is different from other pandemics or other disaster, we say, because this pandemic is global, that is all are affected, no definitive treatment available at present, endpoint actually not known exactly to all, and this pandemic is like two-edged sword, because we have experienced some disaster in the past, like Latur earthquake, floods in Maharashtra, but in those situations the victims were the affected individuals and psychological issues were there in the victims, but the people in the caregiver were mentally stable and healthy. But in this pandemic, it is different that both the sides are affected. Means doctors are also emotionally facing issues, physically facing issues, and also the victims are facing issues. So it's a two-way sword. So the goal of this is of restoring mental health of healthcare workers as well as the community, right? So, there are many stressors in the COVID-19 pandemic for emergence of the psychological issues like uncertain diagnosis. There is looming severe shortage of resources of testing and treatment, imposition of unfamiliar public health measures like infringing on personal freedoms, that is lockdown, large and growing financial losses, conflicting message from authorities, and there is a lot of fear about everything happening around us. We are talking about stress, and stress is the reaction of the people to extreme pressure, which actually is the imbalance between your coping strategies and demand, that is resources. In the scenario, first, I will discuss one small case where a 35-year-old doctor recently, after a few cases of COVID-19, has become a bit worried sometimes about possibility of him and his family members getting affected, and after listening TV news. Since he has received gloves and masks and he is quite comfortable carrying his work, the moment he comes home, he changes his clothes and washes his hands, and regularly these worried thoughts last for 10 to 15 minutes, but he can dismiss them and carry on his daily routine. Dear friends, to any form of stressor, the human mind and body reacts with the startle reaction of fright, that is apprehension, fear, tremulousness, fight, that is we deal with the stressor, and flight, that is we try to escape from the situation, try to run, try to avoid. And I think which is in the few stages, which is normal. If you talk about this doctor, he has occasional anxious thought, which is with no impairment his daily functioning. So this is normal in this current scenario. This just requires little bit reassurance that with about his concerns and understandable and advice to continue the precaution that he is taking. Talking about normality, when we can say the person is having sound and normal mental health, when we can say he is able to cope with his stressors, he can function normally, he can meet his responsibilities, he can express balanced attitude towards day-to-day challenges, problems, he is experiencing pleasure in what he is doing. So if this is fulfilling, we can say that this person or any person can function normally. While in second case, a 40-year-old banker become very anxious as he worries that he may get infected. He is using sufficient personal protection equipments. Still, he is become anxious, panicking, and tense most of the time, becoming angry for trivial reasons. His sleep is disturbed, and he feels that food doesn't taste good. He continuously watches WhatsApp forwards and keeps checking the news on COVID-19 on the internet, but he manages to do his work with difficulty, with forcing himself. This is a very common scenario that occurs in a significant life change when people experience heightened anxiety but are still managing to carry on. According to ICD-10 diagnostic criteria, this is a typical case of adjustment disorder with predominant anxiety, which we most of the people have experienced in initial days of lockdown. Dear friends, every person experiences stress, but if the stress become persistent, it becomes distress. And if the distress become continuous, then it becomes an disorder. And so the journey between distress and disorder is very important. There are various preventive measures where we can work on distress to come to the normal state of mind. But if it doesn't work with the proper strategies of coping and problem solving, this can go to the disaster. But disorder. But when disorder occurs, there are three causative factors of disaster. That is biological factors like your genetics, like your biological neurochemicals that sir is talking about, and your psychological status. How is your personality? How you cope? How are your defenses mechanism you is? How are your temperament and social skill and other social factors, that is use of alcohol, school, how is your peer group. So these factors responsible for the disorders. In coming years or now in our OPDs, we are experiencing more of psychopathology and any form of disaster. We see 17% of the people get suffered and have significant diagnosable psychopathology. Like as we say, like substance use disorders, sleep disorders, suicide, anxiety, PTSD, and severe psychotic disturbance. This need a separate lecture, and we can go into details. But I have touched the few aspects of that. Apart from psychiatric issues, there are a lot of psychological issues we are facing in this pandemic, like child and adolescent psychological issues, relationship issues like domestic violence, old age issues, psychological issues related to pregnancy, psychological issues related to isolated people, quarantined people. So there are a lot of psychological issues of migrant and all. Friends, in children also, as children understand, they have ability to think, ability to observe. They also these children can also have sensing overwhelming uncertainty due to pandemic. Children may experience a range of psychological disturbances. Children with physical and mental disabilities nowadays are more vulnerable for psychological issues, and issues related to finances, parental addiction in parents affecting the children's psychological health. As see my child in my home, made a song on corona. She sanitized herself. She follows advices for precaution and asking questions about corona. That means children's can think and they can have an uncertainty and anxiety also. Similar thing happening in the old age people. Similar issues of hospitalization, whether they get respiratory distress, whether they will find a ventilator, or what is the mortality rate. All these things are also creating a lot of distress in old age people, and also social isolation in old age also giving to lot of psychological issues. Most affected people, like I said, it's a double-edged sword. Like health workers, like our doctors, paramedical staff, pharmacists, like government authorities, police who are working for corona are going under a lot of stress and emotional disturbances. And burnout is the commonest disabling mental issue with healthcare workers in any pandemic. There is a lot of overload, irritability leading to exhaustion, emotional exhaustion, physical exhaustion, and there is a total burnout. Risk factors for burnout in healthcare workers is long working hours, worry about risk to self and family, concern about inadequate personal protection material, separation from family, stigma, quarantine, pre-existing mental issues if they having an addiction. These factors are prone giving going to the burnout. There is a triad of symptoms in burnout like emotional exhaustion, that is there is depersonalization, that is loss of one's empathy, caring and compassion, and decreased sense of accomplishment. There are a lot of physical and behavioral issues. Despair is that is absence of hope is the dominant feature seen in the healthcare workers. And I will say burnout is a self-perpetuating because of inadequate coping strategies. There are a lot of issues related out of the burnout, like absenteeism in the work, quality and quantity of life and work is reduced job satisfaction, issues of recruitment and poor communication, increasing conflicts at workplace. Lots of patients coming to our OPDs. I will say during this pandemic and after the lockdown, also a lot of patients will come into the OPD, and with their current diagnosis, we will get the dual diagnosis of psychological issues with that, and we need to address these issues very delicately. Few questions I will say you can ask in your OPD, or if your colleague, if your friend is having certain disturbances, like how would you like to share your concern? How is your mood since last few days, weeks? How are your relations? How is your sleep? How is your appetite? And how is your interest in doing your daily work? So this question you should ask to every patient visiting to our OPD during and after the pandemic. There are certain questionnaires, but I think this it will be difficult to apply in the OPD scenario. There are certain drugs we can use if we feel that patient is in delirium, haloperidol or olanzapine. If a patient is having psychotic breakdown, you can use risperidone and olanzapine. In anxiety scenario, you can use lorazepam, clonazepam, citalopram. And in depressive disorder, you can use sertraline. In insomnia, there are a lot of benzodiazepine, non-benzodiazepines like zolpidem, amitriptyline, quetiapine you can use in the OPD scenario. But apart from these, you need to teach ourselves and to our client, patient, and our surrounding people regarding the self-help skills, that is managing how to acquire your self-help skills to face these emotional and behavioral issues of pandemic. When any patient or person visits to you, acknowledge and validate the emotions and use a non-judgmental approach. Be empathetic with that patient, and say only one sentence you can say to your patient, that I understand your concern and emotions. This is a statement which is very encouraging and boosting to the people. Only one sentence, rather than saying tension घेऊ नको, तुला काहीच होत नाही, जास्त विचार करू नकोस. Acknowledging and validating the emotion, empathizing is very important. Like you can also ask about certain concerns about his family, self and situation, and you can address the dominant concern in that client, in that person, right? Advise these people to uh, socialize from home, that will reduce their loneliness. People use alcohol in this lockdown. We are listening lots of news about alcohol, and it is making havoc. But alcohol temporarily relieves, but it doesn't solve your problem. Rather than it increases your stress. And this is a faulty coping mechanism you are using. Certain people are using it for the enjoyment, but there are lots of other forms of enjoyment available within home only. So motivate people to follow their daily routine, because if you follow your routine now, it will help you to follow your routine after the lockdown also. Encourage physical activity in the home only. You can advise your clients, people are to self also certain breathing exercises. If people can do yoga, that is better. But if people not are expertise in yoga, they just can have a shwasacha vyayam karu shakta, right? Breathing exercise only 10 minutes 2 times a day, reduces your anxiety, relaxes your body, and this relaxation allows your mind to think constructively to deal with your daily hassles and hassles coming into the future. There are we are a lot people watching bingely watching news channel. I will say reduce or cut down watching less news channel, because no need to watch the news channel or social media throughout the day. It will not cure corona, rather than it increase your panicity by overload of or an excess of information. And media, whether it is social or which form of media, it gives you a virtual reality, not exact reality. So I will guide to focus on real news, and that will only through 15 minutes allotted time to see news from authorized source that you all know. Allay the anxiety by giving authentic information to your patient and to yourself also. Your mind talking negative things to yourself. What are the negative thoughts coming to your mind during our in this pandemic? Like, अरे बापरे, आता कसं होणार, पुढे कसं होणार, माझं पैशाचं कसं होणार, घराचं कसं होणार, घर बांधायला घेतलं होतं, माझ्याच बाबतीत असं का घडलं, मी आत्ताच दुकान टाकलं होतं ते बंद पडलं, किंवा मी आत्ताच प्रॅक्टिस चालू केली होती ती आत्ताच त्याच्या वाट लागलीये, कोण म्हणले एवढे केसेस झाल्या, का म्हटले, केव्हा म्हटले, कशाला म्हटले, मी एकट्यानंच किती सहन करायचं, माझ्यावरच सगळा लोड आहे, काहीच चांगलं होऊ शकत नाही माझ्या आयुष्यात, मी असं करायला गेलो आणि तसं झालं. लॉट ऑफ सेल्फ टॉक इज हॅपनिंग विथ द पीपल. माझ्या नशीबच फुटकं आहे, माझ्यासोबतच असं झालं, लोक काय म्हणतील मी जर कोणाला हे सांगितलं तर, सर्वजण हसतील मला, समाजाला काय तोंड देऊ. दिस टाइप ऑफ थॉट सेल्फ टॉक इज कमिंग टू माइंड, and I think we should observe our self talk, because there is a cycle of thought, emotion, and behavior, and in our self talk we are experiencing thoughts, and these thoughts are giving rise to the healthy and unhealthy emotions both. And because of the negative self talk, it is creating more and more unhealthy emotions like anger, frustration, depression, anxiety, apprehension, like that. So self talk is very important, and I will advise to focus on our self talk, because where the energy flows, things grows there only. I will advise how to manage this self talk with 5 distressing keys or tools. First and most important tool is focus on factors within control, and don't focus on factors beyond your control. In current situation, like I discussed in scenario 2, case number 2, that person is very anxious, disturbing, watching WhatsApp news, watching television, like binge. So what are the factors within control? What I can do myself by sitting at home, that is very important. Which are the factors? I can take protective protection, I will take precaution, I will use the healthy coping strategies, I will exercise, I will focus, and I will plan in this period. These are the factors within my control. I will second is generating alternatives. I will generate the alternatives for the problem which I am currently facing with. So generating alternatives giving you the develop your critical thinking and analyzing thinking to help yourself. Third important tool is problem versus frame. Ask your mind whether you really want to solve a problem or you just want to blame. Nowadays, we are blaming to lots of people. We are blaming people. We are blaming authorities. We are blaming media and doctors, and lots of things happening. Fourth important tool is avoid labeling. Avoid labeling to self, others, and the system. Focus on behavior, not the person. कृतीला बद्दल बोला, व्यक्ती बद्दल नाही. Because if you label to the person may be you or other, chances that you will reject that person. So focus on behavior is very important, and that will reduce the domestic issues, relationship issues, or issues you are dealing with your colleagues. There are fifth tool is expectation versus demand. We have lots of expectation, but these are not expectation but demands. Like हे असं झालंच पाहिजे, असं व्हायलाच पाहिजे, नाही झालं तर मग असं तसं तसं. So this is actually demand. So try to avoid must and should from your thinking and communication. बोलण्यातली आणि विचारातली च ची भाषा आपण कमी केली the you can come from demand to expectation, because demand is creating more unhealthy emotions in your mind. So accepting the scenario, if you accept the self, accept the reality, and accept the situation, there are chances that we find out to the solution by using all these tools I have mentioned in the five parameters. Later on, we have to prioritize our thing. I think current priority is an urgent priority, and then there are important priorities in our life like finances, our business, and there are a lot of priorities depending upon the person. But current urgent priority is health, and everyone has different priority list. Agreed. Current common priority is health, health, and only health. Okay, but in this situation of lockdown, we have got time. So, looking towards our urgent priority in the time the time we got, we can definitely plan for the future, our concerns, right? How can we help children to cope with this pandemic? They have realistic and some have exaggerated fears. We should tell the ambiguous and clear information to them in short sentences, not in essay format. We have habit of telling people, children in a essay format, short simple statement they understand. Answer your children queries, but figure out a way of striking a balance. त्याला असं म्हणू नका की तुला काही कळत नाही, तुझं काही कोरोनाशी घेणं देणं नाही, तू चुपचाप घरात बस. Answer your children's query. Children shouldn't excessively exposed to pandemic related information. Avoid too much discussing about corona and its effect in family. Answer questions honestly. Don't say like there's nothing to worry. Rather talk about what the family will do if anyone fall ill. Talk about problem solving. Create new routine for household and for children. For adolescent, engage them into an open, non-judgmental communication. Listen to them, clarify their doubts, reassure them, generate hope into them, and provide emotional support. Negotiate with adolescents to ensure limited use of gadgets and to discuss the inclusion of healthy non-gadget activities if they quarrel. Watch out for repetitive assurance seeking. If any child is asking repeatedly about corona things, repeated assurance, this is a sign of distress in children, and this definitely need a professional help. How can we help the old age? Because they also facing lot of issues. Like we can teach the self-help skills as we have discussed earlier. They need reassurance. They get information and clarification about various myths and false messages. Clarification about death rate is also important with the old age. Guidance about maintaining a routine is important. In burning out healthcare workers, the person should practice self-care and self-help skills as we have discussed. Team leader of any hospital or organization where healthcare workers are working, the team leader should employ steps to minimize the mental health difficulties in healthcare workers, like shift in work, creative activities among doctors, socialization through digital media, sharing ideas with each other, with colleagues, ventilating concerns with each other. And if still the any person is having persistent in their distress, the person should be identified and should be intervened at the proper time. Feeling of unity in healthcare workers or any form of healthcare workers, which those who are supporting in this pandemic, feeling of unity increases your confidence, friends. Emotionally unhealthy person uses immature defenses in crisis situation, like denial, rationalization, projection, displacement of their unhealthy emotions. Emotionally healthy person uses his mature defenses in any critical situation, as suggested by Sigmund Freud. Let us all use the defenses for healthy coping. And these are the 5 mature defenses explained by Sigmund Freud to deal with the pandemic, and we all should use that. First is affiliation, turning to other for help and support. Share your problem with others. Don't hesitate. People are there to help you. Second is suppression, voluntarily exclusion from awareness, anxiety producing feelings, ideas, and situation. That's why I said don't talk much about corona in its effect in your family, at workplace. Exclude it from your routine. Third is altruism, Altruism, constructive service to others which brings pleasure to you, that is helping to others will helping to you, is very important in pandemic situation. I think all the doctors and healthcare workers are doing this altruistic work nowadays, and they do always. Next is sublimation, channelizing of unacceptable impulses, emotions into acceptable ones. Use humor in your communication with your friends, colleagues, not sarcasm. Sarcasm will create disturbed emotions and will disturb your emotion. Use creativity in your home, your routine. If you are doing duty in a pastime, you can follow the creative and these other form. Lots of activities you all know you can do. Next important mature defense is anticipation. That is realistic thinking and planning about future unpleasant events. So this time you can utilize for planning for the further consequences, anticipating the consequences. Make your plan into plan A, plan B, C, and how will you implement in future. That you need to understand. Dear friends, situation created due to corona pandemic is really difficult, no doubt, but still we can stand it. आपण हे सहन करू शकतो. When we say I can't stand it, मी हे सहन करूच शकत नाही, it will block your self-help skills and you become frustrated. But when we say to our own mind that yes, situation is difficult, but I can stand. खरंच परिस्थिती अवघड आहे, पण तरीही मी सहन करू शकतो. Because when we say to my mind like this, then we start using self-help skills and problem-solving strategies and effective coping strategies. So we need to correct this cognitive error if someone is dealing with. Dear friends, we have to increase the resilience. It's time for me, you, and society to increase our resilience, that is toughness, by using all the discussed strategies to bounce back from this negative experience now and onwards. Dear friends, still anyone is persisting with his negative emotions, he is disturbed, his personal emotional life, his relationship life is disturbed, his sleep appetite is disturbed, he is getting lots of suicidal ideas. Don't hesitate to take professional help. People are there to help you. There are lots of helplines started by mental health professional across the states. These are very easily approachable. All psychiatrists in India are doing teleconsultation and also in-person counseling. You can all contact them and take help. Don't hesitate. You are helping you and your family. Friends, this situation is like newlywed bride. We are a bride. We entered in the new world of this. She enters in the new world of this in-laws place. Initially, she finds difficulty in adjustment. There are lots of emotional turmoils, but later she adjusts, finds way, and take that family, the that new family ahead. And so only in darkness you can see the stars. In the middle of the difficulty lies the opportunity. And this is a change occurring all over the world. We can take this change as an opportunity to develop certain qualities in ourselves, and you can utilize this time for better creations. The opportunities are hidden. After 10 years, if you see, we will get two types of people. Few will say, ये कोरोना ने मेरी लाइफ ही बिगाड़ डाली. But there will be many people who will say that corona taught me a lot to change myself and become a better human being. So friends, there is a hope, and hold on, this pain will definitely end. Thank you very much. Together we win.
It was truly a monumental speech, sir, which was completely filled with immense knowledge. And the way of the presentation of yours really made us to feel very hopeful for coping up with this situation. And now we'll move on to our second speaker and the second topic of our today's session, that is neurochemistry of happiness, which will be taken by the most famous, prominent, and popular neurophysician, that is Dr. Abdul Majid, sir. So we will just see his introduction. Dr. Abdul Majid is MBBS MD Medicine DM Neurology from SET GS College in KEM Hospital, Mumbai. Talking about his experience, he is practicing since last 20 years in Aurangabad and has around 1 year teaching experience in KEM Hospital, that is Mumbai, and is co-owner and director of Apex Hospital, which is a 100-bedded super specialty hospital with advancements, especially in the field of neurology. Talking about his membership, he is a member of prestigious societies like American Academy of Neurology, Indian Stroke Association, Indian Academy of Neurology, and Indian Epilepsy Society. At the same time, he has traveled over 30 countries till date to attend and deliver the lectures in neurology conference. And as you know, many of the people know that he's famous poet and a prolific writer too. So welcome you, Dr. Abdul Majid. Over to you, sir.
Yeah, good evening, everybody. After that fantastic talk of Dr. Amol Deshmukh, few things. I'll try to make it a little simple. The topic for today's discussion is neurochemistry of happiness, but I'll cover other aspects of happiness because just discussing neurochemistry is not going to help us. And to start with, the disclaimer is, first of all, this presentation is for me. There are a few questions which we have to answer. This is a kind of poll. So 3 questions will appear on your screen. So just pick your answer and submit. This is the second question. And third question, what percentage of happiness is contributed by our external living conditions? 10%, 25%, 50%, 80%.
It's done, sir.
Yeah, we'll see the result later on. So the disclaimer is, this is for me. I'm not an ideal person. I'm not claiming anything. This should come in our discussion. This is important part and parcel of our life. I'll show the overview first. I'll introduce the topic. Then we'll talk about neurochemicals, and then the concept of pleasure and happiness, and how to achieve this happiness. And then I'll conclude. These are these CMEs and webinars which are going are to impart knowledge to all of us. But I think more important than knowledge sometimes is wisdom. And this attempt is towards imparting little wisdom, which we all need very badly. Knowledge is knowing tomato is a fruit. That's a knowledge. But wisdom is knowing that not to put it into the fruit salad. And knowledge comes from learning, but wisdom comes from living with the people who have wisdom. So you cannot acquire wisdom just by reading books and surfing on the internet. You have to stay with people who have wisdom. I'll start with the story. Few college-going students went on a trip to on a sea. They hired a boat and they were sailing. They decided to make fun of the steersman. One of them asked, "Uncle, आपको physics आता है क्या?" He said, "बेटा physics तो नहीं आता." "अरे आपने तो अपनी जिंदगी बर्बाद कर दी, वेस्ट कर दी, जाये कर दी." फिर दूसरे ने पूछा, "केमिस्ट्री आता है आपको?" कहा कि नहीं। "मैथमेटिक्स आता है?" कहा कि नहीं, आपने तो आपकी आधी जिंदगी बेकार हो गई। फिर लास्ट एक ने पूछा, "आपको कंप्यूटर आता है?" उसने कहा कि नहीं, मुझे नहीं आता बेटा। तो वो सब हंसने लगे, कहा कि अंकल आपने तो अपनी पूरी जिंदगी जाया कर दी। इट हैपेंड सो कि स्टॉर्म आया और भंवर में कश्ती अटक गई। अब उसने कहा कि मांझी ने कहा कि बच्चों, अनफॉर्चुनेटली अब भंवर में हमारी कश्ती फंस रही है, तो हम सबको पानी में कूदना पड़ेगा। अब मुझे बताओ कि आप में से कितने लोगों को तैरना आता है? सारे लोगों ने अपना मुंह नीचे किया, कहा कि हमको तैरना तो नहीं आता। बच्चों, आप आधी और पूरी जिंदगी की बात कर रहे थे। मैं तो अब तैर के चला जाऊंगा, लेकिन आपने तो अपनी पूरी जिंदगी जाया कर दी, वेस्ट कर दी। तो इट्स नॉट Everything is not about learning physics, chemistry, and biology and laws. It is more to that, and that wisdom we should acquire in the life, which is very important for us. How to define happiness? It's a mental state of well-being characterized by positive emotions. It's a huge spectrum of emotions, ranges from contentment, coolness in the heart, to intense joy. That's a happiness. From the wisdom point of view, the people have defined खुशी or happiness as खुशी वो है जिसकी याद भी आपको खुश कर दे. Means when you come back to that incidence, when you remember that incidence, that just remembering that incidence should bring that happiness. That is happiness, really. Why this lecture? Why this lecture is important for us? Life is very short. Everyone is behind the success. Everybody wants happiness in life. For that, we need to prioritize. For example, when we get the salary to our home, we prioritize. सबसे पहले क्या करना है, उसके बाद कैसे करना है, अगर पैसे बच गए तो क्या करना है. टाइम बहुत कम है, करना बहुत ज्यादा है, और इंटरनेट की अवेलेबिलिटी ने तो और कॉम्प्लेक्स कर दिया है कि उतना नॉलेज है कि नॉलेज का इंपॉर्टेंस ही कम हो गया है. तो वी नीड टू प्रायोरिटाइज. We have to see the concept. The whole world is talking of a concept which is YOLO. You only live once. So enjoy life. But the concept given by people with wisdom is YODO. You only die once. So better prepare for that. You have only one chance to perform. Earlier the better. This kind of things people appreciate or understand or acknowledge when they become old. If you start practicing like this from your early age, that is going to be better, and no one should miss the bus because we don't know मौत कब आने वाली है, हमको पता नहीं है. Our concept of success is if you have money, respect, and fame, that is daulat, izzat, and shohrat, you are successful, you are happy, and that is wrong because lots of people have money, respect, and fame. I remember a person coming to me and asking a pill for insomnia कि नींद नहीं आती डॉक्टर साहब, एक गोली लिखिए. जस्ट इत्तेफाक से मैंने पूछा कि आपने क्या क्या टैबलेट इस्तेमाल किए. उसने अपने बैग में से निकाला, कहा कि ये स्लीपिंग पिल है और मैं ये रोज लेता हूँ, उसके बाद भी नींद नहीं आती. तो मैंने जस्ट पूछा कि आप कितनी टैबलेट लेते हैं. I was surprised and shocked. He was taking 30 tablets every night and he could not sleep. He was a big businessman with money, name, fame, everything. And this is what happens. People commit suicide. If you see the most successful people in this respect, izzat, shohrat, or paisa, especially money, when it comes, the end is hanging, drugs, and suicide. They are not getting happiness. That's why they are committing suicide and ending their lives, thinking that all the problems will. The life is very uncertain. We are sitting on a bomb, and we don't know when is it going to explode. This is a poem written by a famous person, which I've translated into Marathi. धुन तुला फक्त दिसू मी आगळा, पाहिजे रूप नवनवा व फॅशन निराळा, दुनियेच्या मोहपाशात गेला तू आवळला, नाही जगतने असा मिटणारा, मृत्यूने सोडला ना किसरा ना दारा, तोच आहे सिकंदरला हरवणारा, दाबुनी इच्छांना कसा प्रत्येक निघाला, पडून राहिला सर्व ठाट व पसारा, मिळाले मातीत राजे महाराजे कसे, झाले मोठमोठाले बेचिराग कसे, मिटले नामवंतांचे नाव कसे, आणि गिळले पृथ्वीने तरुणांना कसे, खाऊनी खेळूनी राहिलास तू बालपणी, निसटली स्वप्नासारखी तुझी जवानी, थकून निस्तेज झालास तू म्हातारपणी, आणि मृत्यू संपून टाकेल तुझी कहाणी, जागा दिल लावायची दुनिया नाही रे, कर्माची भूमी आहे तमाशा नाही रे. So we have to zoom out. We have zoomed in so much that we have focused so much on the materialistic things, the necessities of life, that the bigger picture is out of sight. So we have to zoom out, come out of that first, come out of that, and then see the life in a bigger frame. We have to differentiate between the necessities of life. Roti, kapda, makan, these are the necessities of life. We are not here for this. We just follow the animal instinct and try to get the necessities of life by hook or crook, but we forget the aim of life. Coming to the second part, what are the hormones of happiness? There are four hormones essentially. which you can remember easily by the acronym DOSE. D is for dopamine, O is for oxytocin, S for serotonin, and E for endorphins. So these are the four neurochemicals which are responsible for our happiness, and they differ in various conditions. To start with dopamine, it's a goal achieving chemical. When you achieve a goal, you get a kick and you get a reward, and that helps you to perform more. And it is important for motivation to work, and you get a kind of a sense of pride when you complete a task. A lot of illicit drugs, alcohol, caffeine, chocolates, all increase the level of dopamine, so they are addictive. Even the mouse likes dopamine. This was the experiment when there are two mice. One is with low dopamine and another is with high dopamine. The cheese balls were kept, a bigger one and a smaller one, and there was a fence kept. The mouse with low dopamine did not jump the fence and went to the small cheese ball, and one with high dopamine jumped on the fence and went to get the big ball. Dopamine is released in high amounts when you do a pleasurable activity. What happens when you do a pleasurable activity? Dopamine is released in a huge quantity, and ultimately serotonin is decreased, and you get a hollow feeling or a feeling of repentance, and ultimately it leads to depression. This is a cycle. For example, you do a pleasurable activity, dopamine is released, it is stored in the memory that this particular activity is giving you the pleasure, so dopamine wants to release again. So whenever the appropriate situation is there or circumstances are there, you perform the same activity to get the pleasure, and the cycle goes on. For example, if you post something on the social media, like sharing or writing or comment etc, and then you wait for the reaction, thumbs up, likes, comments and all. When the reaction comes, then you feel like getting rewarded, and then you tend to put the same thing on social media to get more thumbs ups and likes and rewards and comments. So this is a cycle. High dopamine foods are fish, chicken, eggs, nuts and cheese, so you should decrease the intake of this, may be used in the optimum quantity. Second is serotonin, the confidence molecule, or feel good molecule. 90% of it is in intestine and platelets. Good serotonin, what are the indicators of good serotonin level? The person will have good sleep, good mood, high self-esteem, healthy appetite and sex life, and the memory will be good, and he'll be able to perform multitasking. And what are the signs and symptoms of decreased serotonin levels? Is anxiety, panic, depression, and if it is very low, it will produce OCD kind of thing. Diet should be full of carbohydrates. Banana, yogurt are high sources of serotonin, and you can sit in the sunlight for vitamin D, which helps in production of serotonin. These are the circuits which are there. The pleasure, basically this is a dopamine, and this is a for serotonin. It has lots of receptors in the brain. Around 5 receptors are activated by dopamine, but 14 receptors are activated by serotonin, which produces ultimately happiness. So this is comparison of dopamine versus serotonin. It is triggered by the acts of short-term pleasure, and serotonin triggered by acts of long-term satisfaction. Dopamine touches only 5 brain receptors. It touches around 14 receptors. This is addictive. This is non-addictive. Always wanting more, being grateful for what you have. There's a contentment feeling. Oxytocin is a chemical of love. The bonding molecule it is called. Body releases oxytocin when you get affectionate physical touch, such as hug from your family member, from your wife, from your kids, and from your friends. Endorphins are pain masking hormones. These are secreted by pituitary glands. When you exercise, the endorphins are produced, and probably that is the thing responsible for runner's high after running a long distance. Avocados, olives, and coconuts are good sources of endorphins. Melatonin is anti-aging, or it maintains the sleep clock. When the sun sets, pineal gland in the brain starts secreting melatonin. When it is dark, the secretion is at highest at around 2 to 3 a.m. in the morning, the level is high. It helps in inducing sleep, helps combat stress, and it is a powerful antioxidant. If you use the electronic devices before sleeping, the blue light is emitted. It is like daylight, so the melatonin secretion drops, and you will not get sleep. You should use curtains, mask, and loose clothes. If the clothes are tight when you sleep, the melatonin secretion is decreased drastically. If possible, if you get cherries, so well and good before sleeping, it's a good source of melatonin. Adrenaline and noradrenaline secreted in a stressful situation, which increase the blood pressure, pulse, and cardiac output, and your reaction time is decreased. It is produced when adrenaline required. GABA is anti-anxiety molecule. Last year, when I went to US, I read a book by Robert Lustig.
Pleasure and happiness. A lot of people equate the two. Pleasure is short-lived, happiness is long-lived. Pleasure is visceral, happiness is ethereal. Pleasure is taking, happiness is giving. Pleasure can be achieved with substances, happiness cannot be achieved with substances. Pleasure is experienced alone, happiness is experienced in social groups. The extremes of pleasure all lead to addiction. Yet there's no such thing as being addicted to too much happiness. Pleasure is dopamine and happiness is serotonin. There's one thing that downregulates serotonin, dopamine. So the more pleasure you seek, the more unhappy you get. Las Vegas, Madison Avenue, Wall Street, Silicon Valley, and Washington, D.C. have very specifically and in a coordinated fashion confused and conflated happiness with the term pleasure so that you can buy happiness. And in the process, we have become most decidedly unhappy.
Yeah. So we have to differentiate pleasure from happiness. This is the book I was referring to, The Hacking of American Mind, inside the sugar-coated plot to confuse pleasure with happiness. This table again shows the same. It's a short-lived, long-lived act of taking and giving, achieved with substances, can't get with substances, experienced in alone in social groups, addiction, and there's no limit to happiness. It is the substance responsible is dopamine. Here it is serotonin. It can be bought and it cannot be bought. Next question is, can money buy happiness? This was one of the question in the polling session. This is a study from Princeton University, 2010. Once basic necessities are covered, like your basic necessities are covered, money cannot buy happiness. After that, money does buy happiness, but only if spent on others. This was Harvard Business School study. Spend on themselves, it will produce a small spike, but spend on others, 6 to 8 weeks of happiness. Although the people in the West for decades have got richer, they have not become happier. Studies show that people are not happier today than 50 years ago, despite the fact that the income in the period is doubled. The income has increased, but the happiness has not increased. This was the interesting study. After getting the basic requirements, what they have mentioned is more income tended to be associated with reduced life satisfaction and a lower level of well-being. So after a certain level, money cannot buy happiness. Now, how to achieve this happiness? There are various studies which speak about the contributors of happiness. First is proactive life. Happy people have positive goals and positive tasks. Proactive people are 15% more satisfied with their lives. They set goals for themselves again and again. An active life, physically and mentally active one should be. Daily walks raise the level of happiness by around 12%. Giving out, doing good for the world is a source of happiness. It's a probably biggest contributor towards happiness, giving out rather than taking. Givers are 24% more happier, so live as a giving person. Those who give to others discover the beauty in this world. So charity and donation, that is what is needed and important. In this present situation also, this is of very big importance. You have to donate, you have to share to get that ultimate happiness. Rest and relaxation. Find the balance between rest and activity. Enough sleep is very important. Relaxed people think more positively and are happier. Every hour of sleep missed lowers the positivity one can experience during the day. Because of social media, our sleep is getting delayed. So that's why we are not sleeping properly. Most of the times, I think it is 90% of the people, the sleep is disturbed. So the efficiency of working the next day will be definitely less. Positive thinking is very important. Those who think positively double their chance to realize happiness. Focus on wisdom, love, peace, and inner power. TV, net, and social media. Too much of these things make you unhappy. Every hour of TV lowers the general quality of life by 5%. It just gives superficial happiness, increase materialistic desire, comparison, rat race, increase aggression, and ultimately produces some sorrow. So what should we do? We cannot avoid TV, net, and social media, but correct programs, proper feeds. Feeds are very important, like the food. If you take proper food, then you will remain healthy. But if the food is faulty, it's not proper, then chances of getting sick are very high. Similarly, the internet net feeds are very important. Correct amount. After watching, do some spiritual exercise. Don't sleep after watching net or TV. After that, you do some exercise, yoga, meditation, or best is prayers. Foster friendship. Positive circle of friends is very important. Women who talk to others reduce their worries by 55%. As a doctor, you should have learned to listen to female patients, and that helps them a lot. If the doctor listens properly, it's applicable for both male and female patients, but especially for females, their anxiety decreases, their worries decrease. Avoid remaining single and lonely. This was the longest possible study from the Harvard. Good genes are nice, but joy is better. It was carried out over 80 years and still is going on, has proved that embracing community helps us live longer and happier. Loneliness kills, it says. It is as powerful as smoking or alcoholism. When the study began, nobody cared about empathy or attachment, but the key to the healthy aging is relationships, relationships, and relationships. From the wisdom point of view, 3 things they have told. Forgive and forget. You have to forgive them. It is said that pehle mitti dalo. Mitti dalo means hide the mistake. Don't put it on social media. Hide the mistake. Second is clean it. If you put soil or mitti, लोग आके पूछेंगे कि यहाँ क्या हुआ था, तो उसको clean भी कर दो. And then give him some gift. Forgive and forget. Fulfill the rights. Even if the other person is not fulfilling your right, you have to fulfill. And amend the relations. Relations are very important. Relations, personal, professional relations, beautify relations. These are of paramount importance in producing ultimate happiness. Friendship is very important. Example of good friendship is like in the perfume shop. Even if you are not buying, you will be getting perfume, the good smell. And the bad company is like sitting besides the ironsmith. Even if you are not working, the smoke, the fire, they are going to disturb you or harm you. Facilitate joy. Those who can find little elements of joy in their lives can raise their overall happiness by 20%. छोटी छोटी खुशियों को तलाश करो, उसको enjoy करो घर में भी छोटी छोटी. Humor. Those with good sense of humor raise their positivity by 33%. Self-confidence is also important. So we have to set the goals and we have to achieve, and you should be confident about doing that, but understand the human limitations. Psychologically, it is shown that a person has in his brain an area for experiences of God. The enlightened one is happier than unenlightened. It is very important to know. I am presenting 2 scenarios. For example, you have a Merc and you have the best possible roads to explore. You are traveling at a speed of 120 kilometers per hour in Indian scenario, but you are not sure about the road. Where is it heading? Where do you want to go? Then you will be confused. You will lose that inner peace and happiness. Similarly, if you are appearing for exams, the sitting conditions, facilities are best, AC and sitting, everything is good. But when you get the paper, question paper, you don't know the answers. Then you will have that restlessness. So there are some core questions which strike to every mind. Before that, just a minute, we'll go to Hello, remove this. Hello.
Yes, sir. Yes, sir.
Yeah. So what are the core questions? What is life? Who is my creator? From where have I come? What am I supposed to do in this life? Do I need rules and regulations to control myself or me? Am I accountable for my deeds? When and where will be the justice? And what happens after death? These are the core questions. And these questions should cross our mind. So now we'll come to the poll. Again, it seems the connection is lost. Hello, can we put the question?
Sir, it's already there
Okay,
on poll.
okay, right. So if you know the questions, the life is different. Life is different. For example, if you are sitting in the old Maruti 800 and the speed is very less, 40 kilometers per hour, but you are very sure about the road where it is heading, you are sure about the destination, then you are content, happy, and that inner joy and tranquility is there. You have the worst examination conditions, but if you know the answer, then you are happy from inside. What are the contributors of happiness? One is genetic determination. You can't do much about this. 50% of it comes from your genes. External living conditions, they contribute only 8 to 10% of happiness. This is very surprising. It was surprising for me also. Your external conditions, which you are after, your life throughout the day, you are working for that to improve your standard and accumulate the wealth to get the better living conditions. It contributes only to 10% of happiness, and the personal influence is responsible for 40% of this. How to get this? Prayers, definitely it helps. You have to differentiate between the creator and the creation, and you have to bow down to the creator who has made me, and absolutely risk free. It is risk free. I am bound down, I am worshipping to the creator, whatever it may be, but I am bowing down to my creator. Breathing exercises, as Dr. Amol also said, they help. Meditation, begin with 5 minutes and increase gradually to around 20 minutes. Adequate sleep, again, is very important. If you sleep properly, then you are more efficient. Your thought process is clear. And most of the people who have wisdom, they advise get up early. If you see the habits of highly successful people, one of them is to get up early in the morning. That time, I think a lot of wisdom comes because your mind is very fresh. Cleanliness of soul is more necessary than the cleanliness of body, it is said. This is most important thing. You should be clean from inside. You should always speak the truth. No anger should be there, even if you are capable, you have the authority, you have the power, but then still you forget. It gives immense happiness from inside. No flirting. If you flirt, then there are so many complications. You have to lie and lie, and you are under tension, stress. Then you cannot hand over your mobile to your wife to see the messages. If somebody is touching your mobile, you are so anxious, you keep so many lock codes and whatnot. Ethics, honesty, integrity, these are all important things. That's why one wise person has said in Persian language, Nihango ajdaho shero nar ko mara to kya mara. Nihang means big crocodile, ajdaha matlab means anaconda, and shero nar means lion. If you have killed a big crocodile or snake or lion, it's not a big thing. Nihango ajdaho shero nar ko mara to kya mara. Bade muzi ko mara gar nafse ammara ko mara. If you have killed your ego, that is the biggest achievement, he says. That pure and clean heart is very important because ultimately your faith is your driver. When you have pure and clean heart, your actions are controlled by that. And then if the actions are controlled, you get happiness and that bliss. Then staring at people doesn't give that joy. Lowering your gaze will give you joy. भूखा रहने में जितना मजा आता है, खाने में मजा नहीं आता. देने में जितना मजा आता है, लेने में नहीं मजा आता. जागकर उसके सामने गिड़गिड़ाने में, मांगने में, पूरी दुनिया के लिए मांगने में जितना मजा आता है, सोने में उतना मजा नहीं आता. So that pure and clean heart is the biggest source of joy and happiness. Of course, family ties are very important. Spending quality time. I'm again ascertaining quality time is important. We say, okay, I'm there in the, yes, I'm there. No, you have to spend quality time means full attention to wife or to kids, quality time. Prevention from depression is to remain happy is you have to count your blessings. This life was never meant to be perfect, so don't try to become perfectionist. Circumstances are temporary, take them as challenge. Like you take the challenge, like Ramzan is going on now. वैसे ही भूखा रहना तो बहुत इम्पॉसिबल है, इंसान रह नहीं सकता. लेकिन when you take it as challenge कि मेरा रोजा है, so then it becomes very easy. The students take exam as challenge and it's very easy for them to appear for that. Don't have expectations from people. That is very important. And we talk about 50% half and 50% full glass. But I think the fact is that our glass is almost full. We have so many bounties and blessings which are given by the Almighty. So gratitude is very important. Be grateful for the blessing. Look at those below you. For example, this study shows 1 billion, more than 1 billion people earn less than $1 per day, and 2.6 billion earn less than $2 per day. Stop complaining and cribbing. Always complaining. People have complaining nature. वो एक आदमी को मिला तो बोले पानी पीने को नहीं मिलता है. फिर थोड़े दिन के बाद मिलता है पीने को तो मिलता है लेकिन नहाने को नहीं मिलता है. फिर थोड़े दिन के बाद मिला है तो बोलता है नहाने को भी मिलता है लेकिन गर्म नहीं मिलता है. फिर बोला गर्म तो मिलता है लेकिन शावर से नहीं मिलता है. फिर थोड़े दिन के बाद मिलता है तो बोले शावर से भी मिल रहा है, गर्म भी लिख रहा है, लेकिन प्रेशर से नहीं मिल रहा है. So these will not end. So stop complaining and cribbing and be content. Count your blessings. Keep a journal. Write it in that. How many blessings you have got. A person, एक आदमी चल रहा था, गर्म धूप थी जैसे इस वक्त है, पैर जल रहे थे, पैर में चप्पल पहनने के लिए नहीं थी और रो रहा है, चल रहा है और रो रहा है. चलते 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 उसका रोना एकदम रुक गया जब उसने देखा कि एक आदमी सामने से आ रहा था जिसके दोनों पैर ही नहीं थे. तो देन ही रियलाइज किया, अरे मेरे पास तो पैर भी हैं. इसलिए किसी ने, एक विजडम वाले आदमी ने कहा कि खुश नसीब है वो जो अपने नसीब पर खुश हो. खुश नसीब है वो जो अपने नसीब पर खुश हो. बेसिकली कंटेंटमेंट. इसका मतलब ये नहीं है कि यू शुड नॉट स्ट्राइव, यू शुड नॉट वर्क हार्ड. यू शुड वर्क हार्ड, बट आफ्टर यू हैव अ लिमिटेशन. आफ्टर दैट you should not cross those limits. No soul is burdened with more than what it can bear. You cannot change the weather, but certainly we can prepare to face that weather. With hardships comes ease. ये वक्त भी गुजर जाएगा. It's very important to understand. Do the best you can and leave the rest to him. Accept the decline, because everybody, like I am a doctor, I'm not going to remain at the peak of my career. It is going to decline. Health is going to decline. You are going to age and become old. So accept that gracefully to remain happy and content. Take your spiritual break is very important. Don't work like 24/7, 365 days. No, take the breaks, and that should be spiritual breaks. Sharing is caring. Revisiting is pleasant. Should be pleasant, and giving the unexpected joy. If the person is not expecting and you give him a joy, that will give huge happiness to him. For example, if you are your doctor, you just waive off the fees, OPD fees, and he's not expecting that. That gives tremendous happiness and joy. I'm trying to conclude the talk. A person died in a village, and they were very sure that he has died. But few people said, let the doctor come and let him declare. The doctor came with the stethoscope and examined him. People asked, what has happened? He said, everything is fine. The eyes are fine, the mouth, the ear, the hand, the legs, everything. फिर डॉक्टर साहब क्या हुआ है उसको? बोले कुछ नहीं हुआ, सिर्फ उसकी जान निकल गई है. Similar is the situation of ours. Everything is okay from the conception to the last CPR. We know, we have knowledge, but we don't know what's the aim of life. हमको यहाँ क्या करना है, कहाँ से आए हैं, कहाँ जाना है, ये चीज नहीं है. तो हमारे ऐसे ही है कि everything, every organ is there, only जान ही उसके अंदर नहीं है, the soul is not. End your day on a good note. It's very important. When you go to sleep, end it on a good note. Try to remember the events. Try to forgive everybody. Let the heart be pure and content, and then go to sleep. Similarly, let your life end gracefully on a good note, and it will end on a good note if you do what? If you develop a good relation with the creator and creation, you take from the creator and share it with the creation, and this beautiful relation will end your life very gracefully. What are the take home messages? Life is a short, prioritize, understand pleasure versus happiness, be active physically and mentally, be grateful and content, stop craving. Giving is the huge source of happiness. External living conditions play minor role. Purification of heart is very important. Proper sleep and diet are important. Good family and social life is important. Positive attitude is of importance. Think, ponder over, and try to get answers to the key questions of life. Rise above the animal instincts. खाना पीना और अपनी जरूरतों को पूरा करना ये लाइफ नहीं है. And have a higher aim in life. To conclude, the biggest source of happiness is: one is gratefulness, second is giving and sharing, third purification of heart, and beautifying the relation with the creator and the creation. To end with, I'll recite my Marathi poem, which is Jivan Mantra. सकाळ काही काही संध्या, सकाळ काही काही संध्या जमिनीवर फिरावे, जाऊनी जमिनीखाली मग पडूनी राहावे. 4 दिवसांच्या दुनियेसाठी काय काय तरी करावे, आनंदाने खूप हसावे की दुःखाने खूप रडावे. करायचं काय येथे ते लवकर तरी कळावे, राहायचं येथे कोणाला प्रवाशासारखे मग जगावे. छोट्या छोट्या गोष्टींसाठी अस्वस्थ तरी का व्हावे, कबरीला लागते जागा किती आणि बंगले तरी मग कसे बांधावे. झाले बंद सारे द्वार कधीपर्यंत तरी भटकावे, नाही चैन मनाला कुठे कुठे तरी शोधावे. घालविला वेळ सर्व जगावरी, निर्मात्याला मग कधी ओळखावे. ऐकत नाही कोणीच कोणाचं, त्याच्या समोरच आता झुकावे. सोडून अहंकार मागे प्रेमाने सर्वांशी वागावे, न ऐकता ह्यांचं त्यांचं निर्मात्यालाच खुश करावे. भीता दुनियेच्या कॅमेऱ्याला, त्याच्या कॅमेऱ्याला मग कसे विसरावे. पैसानी प्राण नाही आपला, लावून त्याच्यावरच मग टाकावे. जोडून स्वतःला निर्मात्याशी मनात आनंदाचे झरे फुटावे. रडावे मरणोपरी सर्वांनी जीवन ऐसे जगून जावे. करावे तसे भरावे, नाहीतर मग करूनी पाहावे. स्वर्ग नि नरक नक्कीच आहे, नाहीतर मग मरूनी पाहावे. मरायचे तर मरावे पण कीर्तिरूपी उरावे, मरायचे तर मरावे पण कीर्तिरूपी उरावे. थँक्यू.
It was completely a mesmerizing speech, sir. It was completely a fusion of science, philosophy, and spirituality as well. Really, sir, we got a very novel perspective to look towards the life and as emotions and everything. For the attendees, the chat box is open for the questions. If you have any questions or queries, you can go for the questions. Now I request our both speakers, Dr. Amol DESHMUKH and Dr. Abdul Majid, to have a panel discussion so we can conclude with a closing remark. Over to you, sir.
Yeah, Dr. Amol. Is Dr. Amal there? By the time, can we have the result of the poll?
Yes, sir, sure. Yes. So, sir, our first question was, can money buy happiness? So the result is 91% people feel no and 9% of people feel yes.
That's very nice, very nice. Right.
Yeah, actually. Our second question was, has the advent of technologies made our lives happier? So 58% people says yes and 42% people says no.
No. Okay. Right. Third.
First of all, thank you, sir, for the enlightening talk.
Yes, sir. The third question was, the third question for the poll was, what percentage of happiness is contributed by our external living conditions? So it's a mixed answer, actually, sir.
Right.
About 10%, 14% people says that it is 10%. 29% people say that it is 25%, 48% of people say that it's 50%, and rest 10% people say that it is 80%. So it's quite mixed, but it's truly great.
Yeah. That's why I said I was surprised to see that study that external living conditions contribute to 8 to 10% of happiness. That was
Yeah.
surprising for me also. Right.
Yeah, yeah.
And the
It was
last,
great. Last question, the core values which was told by you. So have this, sorry, core questions. Have this core question crossed your mind? So 87% say people says yes, and 13% people says no. So that is
yeah,
also very surprising actually.
it's not surprising because it's a inner demand. That the studies have shown that there is a portion in the brain, and some
Yeah,
philosophers say there is a place in the heart which is not filled unless these questions are answered. So
sure, sir.
unless you have those questions, you cannot get that content feeling and the feeling of tranquility. So you
Yes.
crave for these questions. These are naturally. So I'm not surprised. I'm happy that people think over that, and that is very important, right?
Yeah.
Dr. Abdul,
Yes.
what about your poll?
I think it was not possible because of initial technical error.
Okay. Right, right. Yeah. So is
Okay.
there
So,
any other
sir,
question?
can we?
Yeah.
Yes, sir. There are some questions. So I'll start with first question. What is the best way to increase immunity to protect ourselves from COVID-19, especially for a diabetic person? Any
Uh,
comments, sir?
Actually, we are. I'm a neurologist and is a psychiatrist.
Yeah,
Uh, this question was good for last Saturday's session.
yeah,
Uh,
actually.
but still, I think if you have diabetes, you have to take your doses properly to avoid both hyperglycemia and hypoglycemias. Both the extremes of sugars should not be there, which can be. Being a diabetic, your immunity is definitely compromised. So chances of acquiring any infection is very high. So you have to protect yourself from acquiring any kind of infection. Right.
Yes. So the next question is, sir, what must be the mentality behind spitting on police and hitting the medical staff?
Yeah, Dr. Amol.
Yes. Um, First of all, I want to clarify that most of the people are following the rules implemented by the authority, and most of the people are respecting doctors. We are talking about 1 or 2% people who are doing this sort of behavior, right? Where comes this behavior arises? One is generalization. Many people have 1 or 2 experiences in their life, and they generalize the thing to all of the people. So one bad experience with someone applies to all the doctors. So here it starts with the misbelief in the mind. Okay. Second is mistrust. Mistrust with the treatment protocols, what doctors is carrying, his strategies and all these things. Third is the non-acceptance of situation. If there is any loss with the life situation where these things can happen, non-acceptance of the situation is very important to have that unhealthy emotions, and that unhealthy emotions will create an unhealthy behavior. So these things are happening. And fourth, the most important thing are the faulty beliefs of labeling. First is decrease frustration tolerance, that is decreased resilience in the overall people. And second is the labeling, that is labeling to self, म्हणजे माझ्यासोबत असं कसं काय झालं. अँड सेकंड इज लेबलिंग टू अदर्स, की समोरच्याने गुन्हा केला. मग जर समोरच्याने गुन्हा केला, इफ he has done a crime, देन म्हणजे मला अडवून रस्त्यावर पोलिसांनी मला अडवलं, हा तसा गुन्हा आहे पोलिसाचा. इफ इट इज बिलीफ, देन आय विल ट्राय टू बी इन द कोर्ट ऑफ माय माइंड टू हँडल दॅट, की माझ्यासोबत गुन्हा केला तर मी गुन्हेगाराला शिक्षा देणार, अँड दॅट शिक्षा विल बी बाय हिटिंग. So that is not the proper way of handling the situation. I think that's why I talked in my initial presentation ki emotional literacy is very important, and for preventing it, we should start a separate subject on emotional literacy in the schools, so that people were
Sure,
able
sir.
to handle
Thank
their emotional crisis situations.
Exactly, exactly. A very good and nice thought, sir. Next question is, give some examples of non-gadget activities.
Yeah. First, we need to understand that as we are adult and we have lockdown since 2 months, it's sometimes we are also losing our patience in the home. and it's obvious that children are also having same issues, so we can't neglect that. But as I talked about non-gadget activity, definitely we can do lots of activities like exercise at home, we can do paintings, we can do helping with the mother or grandmother in the kitchen, take their help in the doing recipes. Cleaning home is also a recreative activity children can learn during this time. Like other academic activities, they can do 1 or 2 hours in a day, even if it is lockdown. Talking to their friends, as they are also isolated from their social peer groups. We need to allow them to talk to their friends for some time from in a day. Also, encourage them to talk at least one relative in a day by themselves. Okay, this will increase their socialization. And also remind yourself that before the era of internet and social media, how you are enjoying with the indoor games, right? So remind those games and play with your children, right? These are the all
Right.
non-gadget activities you can do with your children.
Sure, sir. Sure. Next question, sir. Is serotonin reuptake possible using the medications? I think it can be answered by both of you.
Yeah, of course, there are drugs which, and it is very frequently used by both by neurologists and as well as psychiatrists. And there are drugs, but prevention is better than cure.
Yeah.
So once you reach that situation where intervention by a psychiatrist is important, that is important. There is no question about that. It's a medical disease which needs attention, diagnosing, and treatment. If you don't do it and just take the help of these other things, after a certain level, medications are important, and there are medications available. All SSRIs are from that group.
Right.
Yes, sir. One more question, sir. Patients hiding the symptoms of COVID-19. What should we do?
They are hiding because of the most of the time because of the fear.
Yeah.
Okay, so I think awareness is the most important strategies that is actually all the healthcare workers and government is doing. We need to do more frequently and to the depth of the community, so that they will not hide, and they also should come openly when talk with the people that they having people are there to help them.
One more question, sir. Does believing in HODs reduce stress and give happiness?
I suppose it is God rather than HOD. HODs produce tension, head of departments. But God reduces. See, there is an answer to this. Science is ever changing. I mean, we can have study, and this is basically you can experience that rather than quoting studies and science. You can experience. Once you believe in that, you get that tranquility and contentment in the heart. Second, one more important thing is if you take two groups. One is believing in God and living their life with certain rules and regulations, and one is without, because everybody wants to be free. Restrictions are not liked by anybody. So both of them will die. But what will that person lose if he believes in God and follows certain rules and regulations? There is nothing to lose. But if you don't believe and if you have a life after death, then you are at a very, very big problem. So definitely it helps because there is something with whom you can talk, you can speak to, and when you go inside deep and deep, you will realize that you experience the need for them. Right.
Yes, sir. Completely. So these were the questions, sir. I think we should end up the speech. So it was completely a delightful presentation and session, wherein we gained a very different way to deal with our problems and day-to-day things, whatever we are going through nowadays. Through this presentation, surely, sir, we can find a calm touch for our mind and soul and be ready for the better tomorrow. and this is what we can hope for a better tomorrow, I think. And to the conclusion, the last program, that is vote of thanks. I thank Dr. Majid sir and Dr. Amol Deshmukh sir for their wonderful presentation and giving us the valuable time in this whole situation. And also I thank all the attendees from various part of India who are attending our program, and I thank all the backstage people for making this session a wonderful session. Have a great day, sir. Thanks a lot for being with us, sir. Have a great day.
Thanks to you and audience also.
Yeah.